Hello, I am Dawn McGowan, Brandman University's Psych Mental Health Nurse Practitioning student. For the next few minutes, I will use a sample client and show 3 forms of therapy to address his concern. The client has had insomnia since his early 30s. In the past, he has seen his primary care provider and received the prescription of Ambien. The medication works really well for him, and he doesn't want to give it up. But there are health concerns with long-term use of Ambien, to include addiction. His primary care provider has suggested that he see a mental health care provider to talk about therapeutic ways to learn to deal with the insomnia versus taking a medication. During our initial therapy, the client identified excessive worry as part of his problem with sleeping. For the purpose of this exercise, the primary focus will be his excessive worry. However, we have discussed excessive worry as well as basic sleep hygiene, and will continue to integrate the basic sleep hygiene practices into each session, checking in with him to make sure that he's practicing not only good sleep hygiene, but doing his homework on excessive worry. This should give us tools to ensure that he has every opportunity to overcome the excessive worry and anxiousness that's causing him inability to get good sleep. The client is a 50-year-old Muslim male from Morocco. As part of cultural considerations for this culture, I am aware there are barriers that we may experience. First, I'm female, he's male. He may not have a desire to speak with a female outside of his family. In fact, he may not have a desire to speak to any mental health care provider, thinking that it shows a weakness. Helping to establish a good relationship of trust, where he knows that anything he says to me will be held in private and confidentiality, can help with this relationship. In addition, I can dress professionally, conservatively, speak appropriately, and not sit too close to the client when he's in the room. If given all these cultural considerations, he still doesn't want to see me, that's no problem. We should make every effort for him to still get help and offer him a male provider that could possibly make him feel more comfortable. However, I think that if we follow the cultural considerations delineated above, the client can have a good response to therapy with me. Today we're going to try 3 basic forms of cognitive behavioral therapy, CBT. CBT is aimed at changing one's perceptions to help change one's behavior. In this case, specifically, we're going to work on changing the perceptions of his worry and his anxiety so that his behavior, sleeping pattern, is better. The client is holding on to anxiety about future events and is unable to fall asleep. If we can make him see that future events are not here yet and may not even happen, perhaps his behaviors will be in line more with good sleep patterns. This could alleviate much of his current stress. In the first segment, we will use mirroring to assist the client in understanding what is bothering him and causing excessive worry. Mirroring is paraphrasing back to the client what he says. This can lead the client to identify his own problems as the therapist supports and guides him towards potential solutions. We'll transition from the mirroring to the second segment, Rogerian approach. Carl Rogers' client-centered therapy is based on unconditional positive regard, congruence, and accurate empathy. This therapy works by the therapist supporting the client and his work towards self-actualization. The underlying therapy for all cognitive behavioral therapy can be assisted by using this Rogerian approach, making sure that the practice is client-centered. In the final segment, we will use the empty box technique to try and rid the client of some of his excessive worry. The idea is to place what is bothering you into an empty box and leave it there. It can stay there while you sleep. It can stay there indefinitely. If the client ever feels that he needs to get those things out again, he can. But the idea is to place it away from you in a safe place so that it's no longer bothering you. As we transition from section to section, I'm not going to stop the therapy, but it will be evident in mirroring. We'll go from mirroring to Rogerian therapy by an open-ended question. Rogerian therapy will go from Rogerian therapy to box technique by specifically describing the technique and practicing it. So I'm going to now get started with my client. Assalamu alaikum.
Assalamu alaikum.
I would like to video our session today. I will be on audio and video. You will be on audio only. Do I have your permission to record this session?
Yes.
Shukran. How has your sleeping been this week?
My sleeping is not any better. I practice some of the sleep hygiene tools we discussed, but I could not remember most of them and just became frustrated.
I understand it was frustrating for you to try a method of sleep hygiene and then not remember how to do it. Is that correct?
Yes. Last week we talked about working in the sleep hygiene while we addressed my extensive worry.
That's exactly what we said. I will provide you some handouts and websites this week so that you can refer to them when you're practicing your sleep hygiene. That way you don't have to remember it all on your own and you'll have something to review. We can talk about sleep hygiene a little bit each week at the beginning of each session. Then we'll focus on your excessive worry. How does that sound?
That sounds good. I would like to practice the technique more, and having a source of review will help me. I worry so much that I worry about worrying too much.
It sounds like you have so much on your mind. It is difficult for you to think about anything but your worries.
I do. All I think about is what will happen tomorrow, the next day, etc. Will I have enough work to make enough money to pay the bills? What will happen to me if I get sick or I can't work? Things like this.
So you worry about what will happen in the future.
Yes. And I know that it's not good for me as I cannot control what happens in the future. It will be better for me to just focus on the moment and get some sleep. If these thoughts will just stay out of my head, I think it's worse at night because I don't have anything occupying my time like I do at work or when I am surfing and doing yoga.
You understand that what you are worrying about is in the future and it may not ever happen. That's a great start to dealing with your anxiety. What do you think would happen if you were to stop worrying at night?
I don't know. I hope it will help me get some sleep. Honestly, I am just so pissed off at my doctor for not giving me any more Ambien. It has worked so well for me. Why won't he give it to me anymore?
What did your doctor tell you about why he did not want to prescribe you any more Ambien?
Well, he said it was addictive and could have long-term harmful effects. He also said that it would be better for me to learn how to sleep without medication. But when I am anxious and I can't turn off my brain, I just want the medication. Do you think Ambien is bad? Could
My-
you prescribe it for me?
My role as a therapist is to help you find ways to work through your anxiety. Sometimes that's with a medication included, but most often we can find a solution that works when it comes to sleep-related issues. How do you feel about the potential side effects of the Ambien you have been taking?
Well, I really don't want to be addicted to something or take things that can harm me. I eat healthy, I don't drink alcohol or smoke. I surf and do yoga. I do a lot of things to have a healthy life. I wish the Ambien was healthy for me to take because it works, but I do understand that it isn't, and I should find another way to sleep.
You have really good insight into why your medical doctor doesn't want to continue prescribing you a potentially dangerous and addictive, harmful substance. I'm glad you are working on getting rid of the Ambien and contributing to your healthy lifestyle. It can be very, very difficult to give up medications that work for you, but you're taking excellent steps and you're making great progress into possibly finding solutions without medication.
Well, me too, but I do get so frustrated with my thought and anxiety at night. I know how important it is to get good sleep, and I want sleep hygiene and this therapy we're all doing to work so I can get some good rest.
I understand that you need good rest. Everybody needs good rest in order to have a good, healthy life. Along with reviewing the sleep hygiene techniques and practicing them next week, I would like to share another tool that might be able to help you. After I explain it, we can practice it together. You can share your feelings about it, and then you could potentially use it. Would you like to hear about it?
Yes. What is the box technique?
As you lay down in bed and thoughts start coming into your mind, I want you to picture a box. That box is off in the corner of your room, just sitting on the floor. As thoughts pop into your mind, mentally place them in the box, one by one. Just take them from your mind and put them in the box and leave them there. Continue to do this until all those thoughts are in the box, your anxiety lessens, and your mind is more at peace. If more thoughts pop up, just send them over to the box. Let's do a practice of that technique, okay?
That sounds good.
Okay. All right, here we go. We're going to practice that technique. Get comfortable in your seat. Put your head back. Close your eyes. Take a couple deep breaths. Now envision you're in your bed. You're getting ready for sleep. Thoughts and anxieties start to pop into your mind. You're worried about everything that's going to happen in the future. How do you feel when that happens?
My heart races, my palms are sweaty, I begin to toss and turn.
Okay, that makes sense. You're anxious. Those are all symptoms of anxiety. Now let's try it another way. I want you to take a couple more deep breaths. Envision a box in the corner of your bedroom, sitting on the floor, ready for you to use. As the thoughts come into your mind this time, I want you to mentally take them and drop them into that box. The thought comes, you drop it into the box. The thought comes, you drop it into the box. Just take a couple minutes here and practice that. Just going to give you a couple minutes to do that. How do you feel now that you've put those thoughts in a box?
Well, it feels better. No place the thought out of my mind. I felt less anxious. I don't know if it will work and help me to sleep, but it might. I am willing to try it.
Your participation in your therapy and your willingness to try different approaches is excellent. It's going to go a long way to helping you achieve your goals. In this case, your goal is lowering your anxiety and your negative thoughts so you can get some good sleep. For this coming week, I would like you to review the sleep hygiene tools. Here are some handouts and some websites that can help you with these hygiene factors. Here's the handout you can read, and here's the websites for you to review. Do you have any questions for me?
No.
Okay, I will see you next week. I hope you have a great week. I hope you get some good rest. Remember, if you have any questions or need to come to see me a little bit sooner than a week, please call the office and we'll do our best to get you in a little bit sooner, okay?
Thank you. See you next week.
This ends our second session with this book.